morning, I'm Jessica Lovell. Today, we bring you an encore presentation of one of our very favorite programs. Our team is working hard behind the scenes to bring you more amazing stories when our live programming returns in September. If there is an urgent update from the health system, of course, we will be here to let you know first. Until then, please enjoy this encore presentation and make it a great day.
It's hard because I did miss an awful lot of life.
Missing out on life due to migraine. Coming up, meet a woman who is finally finding relief after decades of dealing with the awful effects of migraine. For years, the woman you're about to meet would put on a brave face and just try her hardest to be there for her kids, her husband, and all of her friends. But there were countless times when she was in pain, she was feeling nauseated and just feeling miserable. But today, she feels like she's living a whole new life after finding something that finally alleviates her migraine.
Good day to sit out here, Steve.
70-year-old Sarah Hendren enjoys the warm air and sunlight now.
Pretty day.
But it wasn't always like this.
Bright light is just horrid. I mean, you have to just go into a dark room, get under the covers, get an ice pack.
40 years of daily life-halting pain, a neurological disorder made worse because chronic migraine is often misunderstood. It differentiates from a regular headache.
It's a disabling disease, really. It differentiates from a regular headache in that usually it starts in one place. For me, it's behind my left eye, and then grows from there.
Migraine, first brought on by her menstrual cycle, turned into her decades-long challenge of avoiding triggers.
Smoke, and I can't have the fumes of trucks or cars. Perfumes, hairspray, aftershave, any chemical smells. Loud noises, yeah. Heat and humidity, that's big.
Sarah and her husband even built a little home in Vermont just to escape the Midwest heat. She was suffering about 15 migraine headaches a month. They'd last up to 7 days, keeping her locked away from the world, sick in bed and vomiting.
I was very good at covering.
Imagine all that and trying to raise twin boys.
My goal was, okay, I need to get them here. They have a concert tonight. I need to get to that concert. I need to get a meal on the table. And often I would get, a meal for everybody. And then, boy, I was out.
It affected her work, her social life, and stole time she couldn't get back.
Concerts I didn't make with my husband. The dates, really, the dates that I missed with him. We missed time. We missed, yeah.
Sarah turned to a friend.
A neurologist friend said, you really ought to see a neurologist.
So she did, and later came to the University of Kansas Health System and is now under the care of neurologist Dr. Deetra Ford.
Dr. Ford does a lot of the research that I don't feel like I have to do anymore. She knows what's in the pipeline. She knows what's coming out.
After 100 different treatments over 4 decades, Sarah finally found relief in a preventative medication that would stop her headaches before they began. 6 years later, Sarah feels better and is making up for lost time.
I appreciate every day. I am, from the deepest part of my heart, grateful I get a new life.
And Sarah Hendren is here with us today alongside Dr. Deetra Ford, a board-certified neurologist, Division Chief of General Neurology, and the Director of Outpatient Neurology Services here at the University of Kansas Health System. Thank you both for being here today.
Thank you.
So Sarah, we just heard you say that you get a new life. Very few people get a whole new life. So how does your day-to-day life compare now to when, before you started this new treatment we're going to talk about?
Okay. I, first and foremost, just enjoy every day being present. I enjoy being with friends, having coffee in the morning with my husband, having an evening, e-biking, having lunch with friends. Life is no longer, for now, no longer about the plan B, where I always had to live with the fact that okay, I may not be hit today, but boy, I could be hit tomorrow.
Because when we talked about the pain in that story, it was the pain of the headache itself, but also just the mental pain and strain, knowing when's this going to happen again, and trying to plan life around that. Aimovig, that is the name after 100 treatments. First, I want to ask. I want to ask you how Aimovig has been working for you, and then I'm going to ask you, why did she have to go through 100 different types of treatments just to figure out which one worked? So, how has Aimovig worked for you?
It's life-changing. Just been life-changing. Again,
is it a pill?
Oh, it's a shot.
Shot. Okay.
And my husband actually gives me the injection once a month, and it does not totally take my migraines away. So I live with an average of 8 to 9 migraines a month, but they are controllable. That is the huge difference.
The key is you can tell when it's coming and you can get ahead of it.
I can take an Imatrix tablet, so I still need to do that, abortive medication. I was out to coffee with a friend the other morning, and I said, Chris, if this had been 10 years ago, 6 years ago, I would have had to cancel on you. So I'm not canceling events.
The things that you listed about how life has changed, it's the things that we all take for granted. Just being able to be with friends and family, and just being able to plan your day and not have to have a backup plan. So 100 different treatments. Different procedures. Why so many? I mean, great to have all these options because something's got to work for people with migraine, but why does it take so many?
So we really didn't have the technology available to us readily at that time. Nothing was FDA approved. A lot of the medications were utilized for other medical conditions, and we just transferred them over to hope that they would help for headaches a little bit. And then over time, Botox came around, and then most recently the CGRP, or calcitonin gene-related peptide class, and it's really the first major class that is just completely FDA approved for migraine, and specifically targeting migraine. And so it really took a long time to get that medication there for us to even allow us to have that offering.
Are you hearing similar stories like Sarah?
All the time.
That's really good to know. So we know that words matter. Some people may notice that we're using the word migraine.
Correct.
I had to kind of turn my head around too, because I like to say migraines, plural, because we're talking about 15 of them.
Right.
But why do we say migraine? People have migraine versus they suffer from migraines.
Sure. So I always, try to talk to people and let them know that this is a medical diagnosis. This is not just a headache. This is not any type of headache other than migraine itself. So migraine's a medical diagnosis, just as diabetes or hypertension are diagnoses, and it's taken just as seriously. In fact, I believe that more people, if you look at the data, actually miss work and their normal life activities in their 20s to 40s, which is their most productive time, because of this disease. And so I think that's why words matter, is making sure that we recognize that this is a disease process, it's a medical issue.
So, because when we talk about people want to say, I have a really, you didn't want to tell your friends, oh, I have a headache. People are like, well, I have a headache all the time. I mean, you move on. You have to be very specific. It's migraine. It's not a headache. What is going on inside? Take us inside the head. When we say headache versus migraine, what is the actual physiological difference going on?
Absolutely. So to get not too technical, but we believe that there's some activation of the trigeminal vascular bundle, so basically this area in the brainstem that has some pain generators, and it releases all these inflammatory cytokines and things that cause pain, and basically what then happens is it spreads throughout the rest of the head and causes this throbbing unilateral headache. So one side of the head just starts pounding, and you start getting the nausea and the light and sound sensitivity. It's very uncomfortable. Whereas if you get a tension headache, it's usually just some muscles are tense, or you're having a little bit of stress, something to that nature, missed some sleep, something of that nature.
Gotcha. And you can pop something over the counter.
Ibuprofen works great.
Does this affect women more than men?
It does.
Why?
3 to 1 predominance. Great question. So obviously we think hormones play a big role, as you heard in Sarah's story, but we don't know for sure, but that's a big trigger that we have seen.
So do you think this is just under-recognized? I mean, do we, does that go without saying? Sarah's like, yes, 40 years, it's been under-recognized.
Absolutely. So we definitely think that a lot of people come in and they'll say, oh, I have sinus headaches, or I have tension headaches, or I have, I just didn't eat enough, or something to that effect. And when reality, when you hear their story, it's definitely a migraine. So it meets all the diagnostic criteria. And I think people just put up with a lot of things. So you heard Sarah, she had twins. She had to go through life. She had to keep moving. She didn't have time to go to a doctor and spend all that time on herself. itself, and that's the downfall with migraine.
Right. I mean, you've got twin boys. That was the biggest shocker when you said I have twin boys, and because I have migraines every now and then.
Yeah.
But to have young kids have that debilitating headache, how did you do that?
Well, I had a reprieve from, so I began with the migraines at about age 23, before I was ever married, working in a smoke-filled office. My boss was a chain smoker. Her smoke would come over my cubicle, and by 1 o'clock every day I was miserable. At that time I did not know it was migraine.
Yeah.
I just thought I had a bad headache. I would have to go home, get through dinner, go to bed. And that went on. I wasn't really diagnosed. Okay, so let me go back. When I was pregnant with the boys, I had a reprieve from the migraines. It was wonderful. Did not get one headache when I was pregnant.
Did you think that has something to do then with the hormones again?
I do.
Okay.
Absolutely. And so if I had kept having children, I probably, would have
cut you off at some point. That is not a treatment. That is not a treatment option.
But and so the hope always was too that by the time I went through menopause, I would get a reprieve. I even went through a hysterectomy, thinking that would help too. It didn't, and by the time my children were 4, so I had gone through 4 years, they just slowly started coming back.
So do you think for women who in their 20s, 30s, 40s realize that, and they get to you and you say this is migraine, was it triggered by the menstrual cycle years ago and you didn't realize it, or is this just sometimes happen this way?
Yeah, sometimes it just happens this way. So menstrual migraine is actually kind of a separate diagnosis in itself, and a lot of migraines are triggered by menses, but menstrual migraine itself is due to, we believe, a drop in estrogen. And so
is this a menstrual migraine?
Oh, it grew into more than that.
Right.
Because there wasn't any preventative or any medication at that time in those decades that helped me. They just, the menstrual migraines grew to, and
and then it snowballed.
Many days a week.
Snowballed from there.
Yes.
So let's talk about some of those triggers and just the idea of you working with smoke. Wow, we've come a long way.
We've come a long way. Yeah.
So smoke, noise, light, heat, you basically
road noise
anything,
in a car.
Anything.
It's a senses. I kind of boiled down for myself, and I'm not sure this would be true for everybody, Dr. Ford. But for me, it's an overstimuli to the senses.
Exactly.
And anything that is different. So, when you travel, things are different. You're not in your routine at home. And when you travel, you've got the road noise, or you've got a plane, and you've got the noise in an airport, the smells of people.
It's all senses being affected.
Senses
it could
being
be one
affected.
or any of them.
Right.
Another thing that surprised me was that you and your husband had traveled to Vermont, and then you just decided, I think we should spend a little more time in this environment to get away from this heat and humidity.
The heat and humidity here. Well, we had lived 40 years in Minnesota, so that's where I'd gone through many a neurologist up there that had nothing in their little black bag for me, right? So we were used to cooler temps, but still the summers in Minnesota, we get some hot weather, and my friends didn't see me out in that. I wouldn't work in the garden in the heat of the summer. And when we moved to Kansas City, I knew it was going to be hotter in the summers, but not quite to the extent that it was.
It's quite stifling.
And our Boston son was in the process, him and his wife, of looking for a second place in Vermont to get away to. And they wanted to take us along on the journey, and at the same time get me out of the summer heat here, because that was a huge trigger. And so they wanted us to spend more than just a couple of days. And so they found a property that had a barn on it that had been a workshop, and together with them and a builder, we transformed that into a place for us to live.
I mean, talk about a postcard.
Yeah,
that's a nice little spot to go off to. How lovely! How many months do you spend there?
We spend 4 months there and 8 months here.
So you strategically plan it, and you're looking at. You said you were looking at weather, and you check and see what things are going to be like, and you gotta keep track of everything.
Yeah,
because the environment matters.
The environment matters.
So
it's cooler there. They still have some hot days and some humid days, but it's not Kansas City heat and humidity.
So let's talk about the little black bag that you were saying. 100 treatments is stuffed inside those bags that you've tried over the years. We should probably ask you what you have not tried versus than what you have tried.
A better.
Something that popped into my head, and a lot of people might think of, is Botox.
Yeah.
You know, that was like, whoa, Botox for migraine. Did you try that?
I did try that, and my good friends at the time, after I would have a treatment and we'd have our knitting group get together, oh, I can tell, Sarah, I can tell, you look great. And of course it was never about that for me, and they did 17 injections. This was at the Mayo Clinic, and I was one of the first, again, to try that. I was part of the FDA trials for that. It helped me initially, but it never, not in the long.
Just not in the long term. Does that often work for people, though, Dr. Ford? Some people find success with that.
Yes, absolutely. And even more so recently, we've noticed a lot of success combining the Botox with some of these newer calcitonin gene-related peptide drugs.
So the CGRPs.
Yep.
And so you know, she's doing Aimovig now and has found success with that. So there's several drugs that target CGRP. What is the role in treating migraines for that?
Absolutely. So CGRP, we believe, is intimately associated with migraine in terms of inflammatory markers. So it starts an inflammation and pain cycle. And so if we're able to stop that, either by targeting the receptors or the peptide itself, we're able to dampen that response quite a bit.
So what kind of drugs then target that?
Sure. So there are 3 injectables, an infusion, and a couple of pills, and even a nasal spray now. So we have quite a few different options in our black bag, if you will, now.
The toolbox, the black bag, you name it. But it's got to be good for you, though. Somebody comes in, and headaches, I would imagine, they're not. They're just not a one-size-fits-all. It affects people in different ways and different triggers and different days of the week. And so to know that you can meet with a patient and go, I got options.
Absolutely, and it's great because we have pills for people who don't want to take injections. We have infusions for people who want less time in the office. So we have lots of different options now that we didn't have before. And on top of that, people are in different stages of their lives, whether it's child planning for, you know, having a baby in the future or no longer having babies. And a lot of the medications have a lot of risks to a developing fetus, so we have to think about those things as well. So having these new drugs give us a whole new layer of treatment options.
Sarah, go ahead. Go. You wanted to say
and don't you? I have friends who don't you sometimes combine a CGRP with some of the old time drugs, and sometimes that combination works for them.
Absolutely. Yeah. It's a lot of picking and choosing and finding what works. And I always say we're going to chip away at things. So our goal is always to chip away at the migraines. We may not get 100% relief with one, but if we can get 50 with one and 50 with another, we're slowly moving things down.
We'll figure it out. And anytime we have a patient on, we always talk about the importance of just like how this affects family and you know, before, during, and after different treatments. How did this affect your family life? And specifically, I know your marriage, because you and your husband have a very close relationship, and I got a peek in that. You two sitting on your porch swing and having your tea and visiting. So I know those days were very few and far between. And just this picture back in the day of you guys.
Oh yeah, and that was after a migraine I'd had at a family reunion, and Steve went on with our boys to visit his folks. I needed to recover. We don't, you know, it's not just a matter of the migraine's over and you pop back up. I had recovery days.
So how did Steve deal with that? He's here with you today.
Well,
so he's been along for the ride. But for somebody, you know, we talk about patients dealing with heart issues and cancer issues, and you think about a migraine. It's a disease, as Dr. Ford mentioned, and you have a spouse or a partner at home having to kind of catch the ball. How did that go?
Well, it was hard. I think if he was sitting here, it was difficult. And so I look back at all of those photos that I pulled out for you for this, and I thought, wow, I did more than I thought I did. So I didn't let the migraine totally rule our life. So we would still go ahead and get the tickets to the concert. Maybe along the way, I was sick along the way, and we'd have to turn around and go back home. It was just life.
That was just how you did life.
It was just life.
So you're back to concerts.
Well, yeah.
Do you have any on their list? What are you going to go see? Anything?
Well,
who do you guys like?
we don't have a concert on our list. We have Rome on our list for fall.
Nice.
Which, as he was saying this morning, it's just nice to be able to plan something and know that 99.9% chance I'm going to make it. We've seen a lot of cousins and a lot of people this spring being here in Kansas City.
The little things.
The little things
are happening.
It really is about the little things, and I can be there. We can plan.
No more plan B.
No more plan. First time I had a bunch of cousins over a couple of months ago, and it was the first time I had put an event together, and I had not written down the plan B for this to go without me there.
That was another thing you had mentioned. You mentioned that you have to, like, you have a dinner party, you have to have, hey, in case a migraine hit, if I get one, then I gotta, somebody else has to take over.
That's right.
Here's the blueprint to the party.
We had a reception at our house shortly after we moved here for our son in Boston's wedding, and 2 neighbors helped me run that. And I said, and they didn't know me, we were new here. I said, I gotta tell you, I have chronic migraine and I never know when I'm gonna get hit. And I could very well get hit, and this has got to go on without me, and here's where everything is, here's how it can roll.
Wow. All right.
So,
yeah, lots has changed. So be sure to ask your questions if you have any. Use the chat on YouTube or Facebook. You can email the Medical News Network. Information is right there on your screen. I want to get to some other questions here because Dr. Ford, is it fair to say that people just learn to deal with a migraine? Is that just what it is?
Absolutely. People just decide this is part of my life and this is what I'm going to deal with, and they don't realize all the treatment options out there.
yeah.
So any advice to someone with migraine who's starting to navigate the healthcare system, where they start? Who do they go to? Do they go to their family doctor? Do they come straight to a neurologist?
Sure. So we are really trying to get the word out there that going to your family doctor first is definitely the way to start. A lot of the primary care physicians now are able to start these medications or at least get the conversation going by the time you're able to get in with a neurologist, and then we can get the medication approved and hopefully at an affordable price and get you started on it.
All right. Let's get to a couple questions from our viewers this morning. Stu wants to know, when does surgery for migraine make sense? Who is that right for?
Yeah, so surgery for migraine has been a little bit controversial from the neurology and plastic surgery worlds, and so it's something that we've dabbled in a little here at KU. It's really for the right patient, and there are definitely some markers that we look at for that. So a lot of the time it has to be someone who's responded to Botox or specific nerve blocks, those types of things. So it's a very specific population.
Jeremy has a comment and questions. He says, this sounds very familiar. His wife is having the same experience as you, Sarah, doing the injections. So are there any tips on navigating the insurance side of this? They do have some medications on insurance that some things have been denied. Where do you start with that? Because that can be a mess.
It can be an absolute nightmare. So I would say the best thing to do there is to engage your neurologist. So we have a very great team that works on prior authorizations for these medications. Our nurses are super well versed in what is required, and we're able to document the encounter in a way that helps us get those things approved. And then most of the companies actually have a procedure where they will help financially with people who are unable to afford those medications.
Amy wants to know, do birth control meds affect menstrual migraine?
So that's a great question. So for menstrual migraine itself, we do believe it's due to that drop in estrogen just before the menses begins. And so what we kind of have looked at is a couple of different options where you can do a continuous birth control where you don't actually have those drops. We've looked at certain medications like Frovatriptan, which are FDA approved to be taken during that time frame where you would have the week long of migraines. And then ultimately, though, there is some controversy now with migraine with Aura and some of the oral contraceptive options with estrogen containing birth control may be increasing your risk for strokes, heart attacks, and blood clots. So there's always that discussion that needs to happen with your doctor, but definitely there is a role for birth control.
Sarah, nodding your head, what was your experience?
Yes, well, because I saw not only neurologists through the years, but I had one gynecologist that saw me through those many years. And at one point, because they were so menstrually related, Depo-Provera maybe, or some medication that put me into menopause to see if that would help before having a hysterectomy. And I noticed improvement, so we went ahead and did the hysterectomy, but it just didn't, for me, it didn't last. And I knew that it was no for sure. I knew, but I didn't have really anything to lose. So I gave it a try.
Well, another example of chipping away at migraine, trying to figure out the magic solution.
Yeah.
Dr. Ford, what's the big takeaway from this conversation?
For me, it's get checked out. If you're having a lot of headache days and you're not sure if it's a migraine or a tension headache or anything else, go to your primary care physician, tell them about it, tell them what you're feeling, because there are options for treatment and you do not have to suffer.
Give us a time frame. How long? How many pills should you not be popping every day? How long does it go on for before you go, wait, okay, I'm medicating over the counter, but I need to come see you?
Yeah, so honestly, I say anything more than 5 days a month, it's time to go see your doctor, because that's not normal. We just say anything after 5, you need to be talking to someone and try to figure out a different plan. And there are so many options.
Sarah, so great to see you today, and so we really appreciate you just sharing your experience. I mean, it seems like an extreme experience, but you found your way.
Yeah.
What's the big takeaway from your story?
Well, I would like to add to that, to Dr. Ford, that I don't think a lot of people know how important it is to chart your data so that you can take it to somebody like Dr. Ford and show them this is how many, and chart your triggers, to know your triggers. I'd like to just say to people who, because these CGRPs, from what I understand, only help about 50% of us. So I'm perfectly aware I'm a lucky one. I'm a very lucky one. But for those people who aren't being helped, I just want to say, don't give up. Don't give up. There's help, as Dr. Ford has been talking about. Look forward. In the migraine world, and my migraine friends, we always use the word onward. Onward. Don't look back. Don't beat yourself up. Don't let people tell you it's you work too hard, you put too much on your calendar, blaming you for those migraines. It's genetic, right, Dr. We've got the migraine gene. So as my mother would say every day, she was such an optimist, and she would say, rise and shine, rise and shine. So every day when I had a migraine and I'm getting through those days, I would ruminate on tomorrow will be better, tomorrow will be better. I was a spiritual person. I prayed for strength to get through the migraine. I knew it was going to end. I knew I wasn't going to die. And I always believed that tomorrow was going to be a better day.
Onward.
Onward.
And you turned from patient to activist. Tell us real quick about Headache on the Hill.
Well, I did that several years ago. It's an advocacy group for headache disorders. And once a year, they go to Headache on the Hill in Capitol Hill in DC and advocate for migraine and headache sufferers. And so part of that, when I did that, was to go and tell my story. So I did that a handful of years ago. And it's now just resumed in person. So they did it via Zoom or,
Well, thank you for sharing your story to the masses. Thank you for sharing it here today. We appreciate it.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.